Tragedy in Willowvale. Community heroes lose lives after delayed emergency response. In the serene yet troubled streets of Willowvale, Eastern Cape, a devastating incident unfolded which encapsulates the dire state of emergency services in rural South Africa and the bravery of ordinary citizens in the face of danger. On November 24th, Sikhumbuzo Goso, 67, and Thobile Madwaleni, 65, were fatally wounded after confronting gang members terrorizing their community. The duo, revered in the Mbashe municipality for their courage, confronted the gangsters who had been wreaking havoc in their village, engaging in armed robberies and violent assaults against the locals. This fateful encounter occurred when the gang returned to commit further crimes, including the tragic shooting of 22-year-old Asakile Malandela. Despite their efforts to protect their fellow villagers, both Goso and Madwaleni were severely injured during the confrontation. The community rushed them to Willowvale Health Center near midnight. Shockingly, an ambulance took 12 hours to arrive, which significantly delayed their transfer to a hospital equipped to handle such grave injuries. Mr. Goso was transferred to East London Hospital in the late afternoon, but succumbed to his injuries on arrival, and Mr. Madwaleni tragically passed away the following morning at Butterworth Hospital. The tragic delay highlights a critical issue faced by many rural areas in South Africa, where access to timely and adequate emergency medical services is not always guaranteed. The local community is mourning the loss of two heroes who stood up against crime but were let down by the very system meant to come to their aid in times of dire need. This heart-wrenching event raises questions about the preparedness and resource allocation for emergency healthcare services in rural communities, which are often neglected in the broader scope of national healthcare planning. The story of Goso and Madwaleni, though tragic, sheds light on the spirit of community and self-sacrifice. It also sounds a loud call for significant reforms in emergency medical services to ensure that no other lives are lost due to similar systemic failures. Thank you for choosing Satori News.